Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing plastic surgery in the Scottsdale, Paradise Valley area for over 22 years, and this is all I do. All I do is cosmetic or aesthetic surgery. So I think I have some kind of inclination about all this. One of the common things that I do is laser resurfacing or skin resurfacing. And why would someone have that done? Well, basically people come to see me for laser resurfacing after things like acne scars, a lot of sun damage, if they feel that there's a lot of irregular pigmentation. Here in Arizona there's a ton of sun damage, so it tends to accelerate people's aging processes. So laser resurfacing is really a miraculous procedure. You may have heard about either fractional or ablative versus non-ablative lasers, and basically the difference between those two is an ablative laser, for instance like a full erbium or CO2 laser, is one that completely removes the top layer of skin. A non-ablative laser like fractionated or profractional basically causes some removal of that layer of skin, but also some of that layer is still intact. So what happens is, since there are still parts of the skin that are intact, it heals much faster, although it doesn't tend to give the kind of result that a full ablative laser will give. For fractionated, whether it be Fraxel or profractionated laser, the recovery is easier and tends to be anywhere between 3 or 4 days. That is because some of that skin is still intact and it reepithelializes quite rapidly. For those 4 days or so, I think that you have some resolving redness. Sometimes there are spots on your face, there's some swelling, but after about 3 or 4 days, I think you can feel comfortable with some sunscreen going outside. Right? The ablative laser or full laser resurfacing, whether it be CO2 or erbium, again, removes that top layer of skin, so you're going to have a much rawer surface. Because it's removing that top layer of skin, we're going deeper into the dermis, and that's really where you see the results. That's where you're going to see a lot more smoothing of the skin. You're going to see a lot more regular pigmentation produced. But unfortunately, because of those changes, you're also going to see a lot more redness. So because there's no layer intact of the skin after full ablative laser, it takes longer to heal, and I think the recovery is a little bit more cumbersome. So for that first week or so, it looks like you've had a bad sunburn, and you're really not going to want to go outside. What you're going to want to do is keep that area moist with some ointments for the first week or so, and we don't want scabs to form. You'll keep it clean with some different kind of washes. But after that week or so, when that skin reepithelializes, I think that you're safe to go outside. We generally have people use liberal sunscreen, and we start putting on some kind of post-laser creams after that first week to help minimize the inflammation. Unfortunately, the redness is a good part of all this because that's what causes the skin tightening, that's what causes the skin to look thicker and actually rejuvenating. So that's a necessary evil here. But overall, the general rule is for non-ablative lasers, it's about 4 days. For ablative lasers, it's a week or so, and that encumbers more redness. There generally is no pain involved with either. It's just a nuisance because you have to keep the areas moist. So the best way to know if you're a candidate for laser resurfacing is go on the internet, take a look and see what it's all about, but most specifically, go see a board-certified plastic surgeon to get an idea of what your options are and what you're looking for. Thanks a lot.